Depression in Young Children and How It's Treated by Casey Swanson. Depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Depression is treatable and many people overcome it. Symptoms of depression in adults include feeling sad or having a depressed mood, changes in appetite, trouble in sleeping or sleeping too much, loss in energy, difficulty thinking, concentrating, or making decisions, thoughts of death or suicide. Symptoms must last at least 2 weeks for a diagnosis of depression to be made. Symptoms of depression in children include hopelessness, frequent sadness, inability to enjoy previously favored activities, low self-esteem or guilt, extreme sensitivity or rejection to failure, difficulty with relationships, poor concentration, major change in eating and sleeping patterns, thoughts of it or expressions of suicide or self-destructive behavior. Sometimes it is hard to notice the symptoms in children unless something is said. There are many different kinds of depression, such as major depressive disorder, persistent depressive disorder, seasonal affective disorder, and postpartum depression, but I am mainly going to be focusing on major depressive disorder. Depression is different from sadness or grief and bereavement. The death of a loved one, loss of a job, or the ending of a relationship, such as a friend moving away, are very difficult experiences for a person to endure. It is normal to feel sad or for grief to develop in response to a certain situation. Those who are experiencing loss often might express themselves as being depressed. In grief, painful feelings come in waves, often intermixed with positive memories of the deceased. Self-esteem is usually maintained. In major depression, feelings of worthlessness and self-loathing are common. Depression can affect anyone, even a person who appears to live in a relatively ideal circumstance, such as in a happy home with loving parents. There are several factors that play a role in depression. The first factor is biochemistry, which are the differences in certain chemicals in the brain that may contribute to symptoms of depression. The next factor is genetics. Depression can run in families. For example, if one identical twin has depression, the other has a 70% chance of having the same illness sometime in their life. The next factor is personality. People with low self-esteem, who are easily overwhelmed by stress, or who are generally pessimistic, appear to be more likely to experience depression. The final factor is environmental. Continuous exposure to violence, neglect, abuse, or poverty may make some people more vulnerable to depression. Depression is among the most treatable of mental disorders. Between 80 to 90% of people who suffer from depression eventually respond well to treatment. Before diagnosing someone with depression, a health professional should conduct a diagnostic evaluation, which includes an interview and possibly a physical examination. In some cases, a blood test might be done to make sure the depression is not due to a medical condition. The evaluation is done to identify specific symptoms, medical and family history, cultural factors, and environmental factors to arrive at a diagnosis and plan the next steps. Psychiatrists usually recommend that patients continue to take medications for 6 or more months after symptoms have improved. Medication is a common way to treat depression. Antidepressants might be prescribed to help modify the person's brain chemistry. Antidepressants may produce some improvement within the first week or two of use. The full benefits may not be seen for 2 to 3 months. Psychotherapy is also referred to as talk therapy and is sometimes used alone for treatment of mild depression. For moderate to severe depression, psychotherapy is often used along with antidepressant medications. Electroconvulsive therapy is a medical treatment most commonly used for patients with severe major depressive disorder or bipolar disorder who have not responded to other treatments. It is involved of a brief electrical stimulation of the brain while the patient is under anesthesia. A patient typically receives this 2 to 3 times a week for a total of 6 to 12 treatments. What can parents do? Parents can become known of the warning signs of depression and note how long the problems have been going on, how often they have been occurring, and how severe they seem to be. They can also see a mental health professional or the child's doctor for evaluation and diagnosis. They can get accurate information from libraries, hotlines, and other sources. It is important that they ask questions about treatments and other sources. Finally, they can talk to other family members or find a family network organization. Consequences of depression. Once a young person has experienced an episode of depression, he or she is at risk for developing another episode of depression within the next 5 years. Depression in childhood may predict more severe depressive illness in adulthood. Depression in children and adolescents is associated with an increased risk for suicidal behaviors. There are many ways to prevent depression. It is important to get enough sleep. According to researchers, disturbances in circadian rhythms have been linked to depression. Exercise also helps to increase your mood. It is important to regulate your blood sugar by making sure to eat regular meals and snacks, including a good source of protein for every meal. It is also important to eat healthy fats, such as fish, flax seeds, and walnuts. Finally, find a passion in life, such as activities you enjoy that give you a sense of purpose.